lovely people, welcome back to my channel. This is Abdul Malik. Please, if you have not subscribed yet, go down there and subscribe. Then after that, you hit on the notification button so that in case we have any new video, you'll be able to have access to them. Today we are going to look at hypothyroidism. You know, when it comes to the thyroid gland, it is part of the anterior part of the neck, okay, and this one enhances the metabolic activities. Okay, no, there is a hormone that this particular gland secretes, and this hormone is responsible for metabolic activities within the system. In a situation whereby this particular hormone, okay, or the gland does not produce enough hormone, then it means that, okay, hypothyroidism is going to occur. And what are these hormones that we're going to talk about? Okay, the hormone is T4 or levothyroxine or levothyroxine or okay, trihypothyroid. Now, these particular hormones, the T4 and the T3, they are very, very important part to take notice of when it comes to this particular condition called hypothyroidism. Okay, now hypothyroidism, okay, the hypothyroid state resulting from hyposecretion of thyroid hormones and characterized by a decreased rate of metabolic activity. Remember, when we talk about metabolism, you know, the heat production, okay, sometimes you feel warm, okay, when it comes to digestion, all those kind of energetic activity that, okay, the body, enhances. All this thing has to do with what? Metabolism. Now, in the situation whereby there is hyposecretion of the T4 and the T3, it means that, okay, there's going to be this condition called hypothyroidism. Remember, okay, and in as much as there is a low production of this, it means the thyroid stimulating hormone will be higher. Why am I saying this? It is because anytime there is hyposecretion of the thyroid hormones, the thyroid stimulating hormone, remember, stimulating, when we say stimulating, it means that it is going to ginger it so that there will be more production of what? Of the thyroid hormones. That will enhance to increase what? Metabolic activity. Now, if there is low secretion, then the thyroid stimulating hormone will increase so that there will be what? Enough production of this particular condition. So take note, in the diagnostic, okay, you see that the T4 will be lower and then thyroid stimulating hormone will be higher. Why? Because the thyroid stimulating hormone will increase to be able to enhance the gland to produce more of what? The T4 for metabolic activities. So take note of that. Now that we have this particular condition, let's see how we're able to diagnose it. We'll be able to manage it or assess it. What will be the assessment finding when it comes to this particular condition? Remember, when it comes to thyroid stimulating hormone in their production, whenever it is low, it means that everything within the system is going to be what? Low. Remember, hypo. So it goes with the prefix, hypo. Everything, okay, all the system will shut down. The system will start shutting down. So it means that metabolic activities is reduced and everything is also going to be reduced. If the system is shutting down, it means everything will go low with the exception of what? Weight. Why? Because in hypothyroidism, there is going to be what? Weight gain. There is going to be weight gain. Take note of that. Meanwhile, everything will shut down. Now, let us see all those things that are likely to shut down due to what? Decrease in metabolic activities as a result of what? Low or hyposecretion of what? Thyroid hormone. Now, you see that we are going to have this particular weight gain. I told you already that there's going to be weight gain. Why? Because the calorie that was supposed to be breaking down for this energy and those kind of activity to take place are not happening so due to what? Hypothyroidism. And then remember, okay, metabolic activities is reduced. So the patient is going to gain what? Gain weight. And the patient is also going to have what? Fatigue. Remember, I told you everything is going down with the exception of the weight. Fatigue is going to be present and lethargy is also going to be present. Take note of that. And then the patient is also going to have bradycardia. Everything is going down. So bradycardia, it means that low pulse rate is going to happen in this particular condition, and then high cholesterol. If there is no metabolic activity or breaking down of this cholesterol level, it's not happening due to what? Hyposecretion of the thyroid hormone. It means that, okay, the cholesterol level will increase. So there's going to be what? High cholesterol level, and the patient is going to lose memory. Loss of memory is going to be present, or forgetfulness. Forgetfulness is going to happen in this particular patient, and there's going to be generalized puffiness, and then there's going to be edema around the eyes. They are very, very important point to take notice of. And then muscle weakness. So everything is going down with the exception of the weight, and then thyroid gland will also enlarge. And then when it comes to the cholesterol, they are going to what? Increase. So take note, In this particular condition, everything goes down with the exception of what? Weight. With the exception of what? Cholesterol. And then with the exception of what? The thyroid gland. So the thyroid gland is going to be enlarged in this particular condition. And the skin is also going to be dried. Dry skin. Nothing is happening in this system. And then one of the cardinal things that you should take notice of in NCLEX, what is it? You are going to have what? Cold compress in hypothyroidism. The patient will not be able to tolerate coldness because of what? There is a decreased metabolic activity. Remember, metabolism, okay, enhances the body temperature. So if the metabolic activity is decreased, the patient is going to be what? Cold. And then the patient will not be able to what? Tolerate cold. So the patient is going to be what? Feel some kind of coldness, and he or she cannot also tolerate the external coldness. Take note. So there's going to be cold intolerance in this particular condition. And then we are saying that in this particular condition, there's going to be what? Paresthesia. Paresthesia is going to be present. And constipation. Remember, everything is going down with the exception of what? Cholesterol, thyroid gland, and weight gain. They are all going to what? Increase. Take note of that. And then there is also going to be what? Menstrual disturbances. Menstrual disturbances and cardiac enlargement and heart failure will also occur in this particular condition. Now that we know the assessment finding or signs and symptoms, then let us go and look at how we'll be able to manage this condition. Remember, vital signs is very, very important, especially when it comes to the pulse rate, because the pulse rate is going to go low in this particular condition, and then we need to administer what? Levothyroxine, thyroid replacement, so that at least metabolic activity will increase. Now take note in NCLEX, in as much as we are giving this levothyroxine, okay, in the form of thyroid replacement, okay, if you overdose it, there's going to be what? Hypothyroidism. It means that the patient is going to be confused, okay, heat intolerance and stuff. So in NCLEX exams, anytime you see somebody taking levothyroxine and the patient starts exhibiting heat intolerance, confusion, weight loss, and then sweating, profuse sweating, it means that the patient is having complication of the medication. You need to report as soon as possible. Take note of that particular NCLEX question. They are very important. And then you need to educate the client in the side effect of the medication. That's what we are speaking about. And then under therapy or under medication, they are also very, very important. When you under medicate the patient will not also be able to get well. And then the need to for exercise. Exercise program is also very important. And you need to assess for constipation. Constipation, remember, is part of it, but that's why we need to give roughages and give a lot of water so that the patient can be relieved from constipation. And then you give a low fat diet and low cholesterol. Why? Because the patient, the already existent the already existing cholesterol level and the calorie is not being able to digest for metabolic activity to take place. Now, because of this, you give the patient low calorie, and then you also give the patient low cholesterol diet. They are very important point to take notice of. And then take note in NCLEX, never try to sedate this patient. It is wrong to sedate a patient who is having a levothyroxine. Because of that, opioid medications are not given, okay, because it can lead to myxedema coma, which is the worst form of hypothyroidism. So take note of this, okay, take note of that. And then you need to provide warmth to the patient. Remember, the patient cannot tolerate cold. It means that the patient needs warm, because there's no metabolic activities going on. Because of that, you need to warm the patient. Okay, these are the NCLEX areas that I should pay more attention to. So in this condition, there is a cold intolerance. The patient already feels cold, the cold, lethargy, paresthesia. There's going to be weight gain, hypercholesterol, thyroid enlargement, bradycardia, constipation, edema, forgetfulness. Everything is going low with the exception of the cholesterol level, the thyroid, increase in thyroid gland, okay, and also when it comes to the weight is also going to be increased. Ladies and gentlemen, that is all for today. Okay, please kindly subscribe and hit on the notification button for a new video. So remember, NCLEX is doable. Please contact us on the following email. Go down there, and then on the screen too, you will see the email. Contact us for your content and the strategy to pass your NCLEX exams. Thank you very much. Once again, my name is Abdul Malik. Have a nice day. Bye-bye.